Never has the need for rapid COVID-19 testing been greater. Unfortunately, most rapid tests today require either a nasal swab or blood sample. But this poses serious testing challenges. Licensed medical professionals are required to draw both of these sample types. This makes these tests difficult to collect outside of a clinical setting. Blood analysis may also require laboratory testing, which can delay the results for hours or even days. So we asked ourselves, what if there was a way to rapidly test for COVID-19 from an easier-to-gather sample like saliva? Aegirbio was determined that it could be done. Introducing the Viraspec COVID-19 Saliva Test Kit. This is an easy-to-use lateral flow test that rapidly detects COVID-19 using ordinary saliva samples. It reacts to the COVID-19 antigen in under 10 minutes, giving a clear, visual result. The test is simple to do and easy to read. Allow the test cassette, specimen, and extraction buffer to equilibrate to room temperature prior to testing. Remove the test cassette from the sealed foil pouch and use it within 1 hour. Best results will be obtained if the assay is performed immediately after opening the foil pouch. Open the cap of the collection tube. Install the saliva collector. Put the collection tube with saliva collector close to the lips and let the saliva flow into the collection tube. The volume of saliva needs to be between 2 scale marks, which indicate approximately 150 to 300 microliters. Place the collection tube with saliva collector containing the saliva specimen in the workstation. Hold the extraction buffer tube upside down vertically. Squeeze the buffer tube and let the solution drop into the collection tube freely without touching the edge of the tube. Add all of the extraction buffer to the collection tube. Discard the saliva collector and tighten the cap onto the specimen collection tube. Shake the specimen collection tube at least 3 times vigorously to mix the saliva with the extraction buffer. Then squeeze the bottom of the collection tube to ensure that the saliva is thoroughly mixed. Place the test cassette on a clean and level surface. Add 3 full drops, which is approximately 80 microliters, of the solution to the sample well marked S, and then start the timer. Avoid trapping air bubbles in the sample well. Read the result at 10 minutes. Do not interpret the result after 20 minutes. The result will come out either positive, negative, or invalid. A positive specimen will give 2 colored lines next to the C and T marks, meaning that COVID-19 antigen was detected. Specimens with low levels of antigen may give a faint test line next to the T mark. A negative specimen will give a single colored control line next to the C mark, indicating a negative result. And if no lines are seen, or if just the test line is seen, the assay is invalid, and invalid tests should be repeated. Viraspec COVID-19 saliva test is ideal for many applications. Use it to test students before class, athletes prior to games, passengers in advance of boarding, emergency room patients awaiting treatment, or transient populations where follow-up with laboratory testing is problematic. The possibilities are endless. The Viraspec COVID-19 saliva test is a simple, qualitative point-of-care test with results in 5 to 10 minutes and available now through Aegirbio.